Amidst the ongoing federal government shutdown, the Centers for Disease Control and Prevention, CDC, has faced a wave of layoffs, leaving many concerned about the agency's ability to function effectively. The Trump administration's push to slash the federal workforce has resulted in the termination of approximately 600 CDC employees over the weekend. With more cuts potentially on the horizon, this has sparked fears that the agency may struggle to maintain its critical operations and provide essential public health services. The layoffs were not without controversy. On Friday, over 1,300 CDC employees were notified of their job losses, many of whom were furloughed due to the shutdown. The next day, around 700 employees received emails revoking their reduction in force notices, leaving many in a state of uncertainty. Erin Knowlton-Backus, a health communications specialist, was one of those affected, receiving her third termination notice this year. The lack of transparency and chaos surrounding the layoffs have raised concerns among employees and experts alike. The Department of Health and Human Services, HHS, attributed some of the firings and rapid rescindments to data discrepancies and processing errors. However, the National Public Health Coalition and AFGE Local 2883, a union representing CDC workers, reported that around 600 CDC staffers were cut over the weekend. These layoffs have impacted various CDC departments, including those briefing Congress, health statistics, chronic disease research, and support staff. The effects of these cuts extend beyond the CDC. State and local health departments, which traditionally rely on the CDC for assistance during outbreaks and emergencies, are now left without a reliable source of support. Dr. Karen Remley, a former CDC official, emphasized the dire consequences, stating, "Now there's nobody to answer the phone." This highlights the potential risks to public health and the livelihoods of those who depend on the CDC's expertise. The Trump administration's approach to federal spending and workforce reduction has been a subject of debate. HHS described the federal health infrastructure as a bloated bureaucracy, aiming to streamline the agency for the American people. However, critics argue that these cuts undermine the nation's public health infrastructure and preparedness for future health crises. With the National Federal Workers Union contesting the legality of these layoffs, the future of the CDC and its ability to serve the public remain uncertain.